you today for your office visit.
Okay.
Can you tell me your first and last name?
Dennis McMullen,
Okay, and how old are you?
19.
Alrighty, so what brings you here today?
I recently noticed, well not recently, 2 months ago I noticed that I was getting this rash on my legs and
Oh,
it kind of
okay.
looks like this ring-like appearance and it's white in the middle
Okay.
and it's kind of been spreading since then.
And you said 2 months ago it started?
Yeah.
Okay. Have you used any creams or medications to treat this?
I tried using some hydrocortisone but it didn't really seem to help in the long term. It helped at the moment but then it got worse after that.
Sure. Are you having any pain in the area?
No, just itchy.
Okay. Alright. And where are you noticing this? How many places on your body?
Just on my thighs.
On your thighs. Okay. No other areas or lesions? Okay. Do you have any history of any skin problems, anything like that?
Nope.
Okay. Any history of allergies or eczema?
I'm allergic to penicillin and sulfa,
Okay. Alright.
but no eczema.
Okay. Anyone else you know have a rash similar to this?
My roommate in college, he has a few spots on his arms and his chest, I believe.
Okay, alright. Do you guys share any clothes, towels, any personal hygiene equipment?
We do share laundry, or we do laundry together sometimes, and sometimes we share our clothes.
Makes sense, living together. Have you had any exposures to any chemicals? I don't know, where do you work at?
At the food service on campus.
Okay, do you do that part-time or full-time?
Part-time, I do it like 15 hours a week or so.
Gotcha. Okay, so no oils, greases, chemicals touching your skin there.
No.
Have you started using any new lotions, soaps, anything touching your skin, laundry detergents that are new?
No.
Okay, alright. Any fever?
No.
Alrighty. Anyone in your family have any medical history and specifically any skin history?
No.
Okay, alright. What can you tell me about your medical history?
I don't really have much of one. This has just
Okay.
kind of been bothering me the last 2 months.
Yeah. Have you ever been hospitalized?
No.
Okay, gotcha. Alrighty, and you said no family history. So, do you use any alcohol?
No.
Okay, any tobacco products? Any drugs?
No.
Okay. Have you recently traveled anywhere?
No, I just went to Florida 2 months ago.
Oh, okay.
Yeah.
Alright. Did you do any swimming while you were there?
We didn't like swim per se, but we used the hot tub a lot with
Okay.
my roommate and a bunch of other people.
Oh, that sounds like fun. Okay. Alrighty. So we talked about your job a little bit. Do you go to school?
I'm a sophomore in
Okay.
college. Sorry.
Wonderful, wonderful. Okay.
And I wrestle there, I guess I should say.
Oh, so you do some sports.
Mhm.
Okay, so is that through the school?
Mhm.
Alright. Any other hobbies or extracurricular activities?
No.
Okay, gotcha. Are you currently in a relationship?
Nope. I'm single as a pregnant.
Alright, and what kind of protection, if any, did you use if you have any, sexual relations?
I would use condoms if I was having sex, but I'm not.
Okay, alright, sounds good. Have you had any chest pain or shortness of breath?
Nope.
Alright, you said no fevers, any joint swelling or tenderness? Any nausea, vomiting, or diarrhea?
Nope.
Okay, alright, so it sounds like the main concern is those 2 itchy areas on your legs. So first, I'm gonna take your blood pressure, pulse, all that good stuff, and then we'll head over to the exam area and I'll take a look at the areas. Do you know how much you weigh approximately?
I think I weigh around 200 pounds.
Okay, and how tall are you?
I don't remember the last time I was measured.
Okay, alright, that's alright. We can do that later on.
Okay.
Alrighty, so can I take a blood pressure on either arm?
Yeah.
Okay, I'm gonna have you roll up your sleeve. That's a pretty thick sweatshirt. I won't get an
No, I
accurate
think
reading. Have you had anything to eat or drink, or I'm sorry, any caffeinated beverages? Okay. Perfect. And anything to eat or drink? Any gum in your mouth? Perfect. Alright, so let's find the right size cuff here. Sorry if my hands are a little cool. All the hand hygiene makes them a little chilly. Alright. Good, so first I'm just gonna inflate the cuff to see where exactly we should bring it up to. Alright, beautiful. (128/68), that's a very good blood pressure. Alright, we are gonna take a temperature too, just to, always good. Check for possible infection. Can you open up your mouth? I'm gonna put this underneath your tongue. Perfect. Alright, 98.8. So next I'm gonna have you come on over to this exam table here and we'll finish everything up over here. Alright, so first I'm gonna listen to your heart and your lungs. Normally I would listen underneath your sweatshirt, but for today's purposes I'll just listen over top of your sweatshirt, okay?
Okay.
So I'll have you take a couple deep breaths and I'll let you know when I need you to do so. Alright, deep breath. Good. Deep breath. Just regular. Good. Deep breath. Good. Deep breath. Okay. Deep breath. Deep breath. Okay. Just the front and the back of your lungs sound good. Your heart sounds normal. I don't see any concerns there. Okay, so my hands are a little bit chilly, but I am gonna just look at your skin overall in general, okay? Have you noticed any changes in hair pattern, growth, texture, losing any hair? Okay, all right. And I'm gonna look, I'm gonna lift up your eyes and this is checking for jaundice. Okay, all right, sounds good. And I'm gonna feel your skin with the back of my hands, okay? Okay, and can I see your nail beds too? Alright, very good. Alright, so can you show me the two areas that are of concern for you?
Right here.
Okay, so kind of on your right outer thigh out here, I see, and then you have another one over here on the top of your left thigh. I'm gonna get out a little measuring tape so that way I can measure it. And then we know if it was growing, getting worse, if you need to come back. Does that sound okay to you? Okay, I'm gonna put on some gloves. Have you noticed any discharge from the areas? No. Okay. And then over on this side, this one's a little bit bigger. So I'm noticing some dry, scaly areas. It's pale in the center in a circular pattern. Is that what you're seeing as well? Okay. Well, Dennis, I am suspecting that you have what is called ringworm. It is a pretty common fungal infection per se, especially with wrestlers or sharing clothes, laundry, things like that. I am going to take a sample if that's okay with you, just a small scraping off of each side, so I can look at those samples underneath the microscope and see if I do see fungus-like properties, and then I will prescribe you an antifungal cream from there. But in the meantime, I want you to keep the areas clean and dry. Don't share any clothes, and you'll need to be off of wrestling for a little while. That way you aren't sharing this lovely skin. Yeah, with
Okay.
anyone else, okay? Do you have any questions for me? We'll kind of go from there, from the test results,
Okay.
and follow up from there.
All right,
All right,
thank you very much.
thank you, bye.